Today, we'll be chatting with Dr. Anna Folklemer, who will be teaching a specialty class during our conference this year. Dr. Folklemer, thank you for talking with us today. This year, during the FASOMA Acupuncture and Asian Medicine Conference, you will be teaching Understanding Central versus Peripheral Nerve Entrapments. Can you tell us what inspired you and led you to create this class?
First of all, clinical need, absolutely, because I think that we're positioned with our Eastern diagnostic approach, we're positioned to really approach someone individually and understand their condition and specifically. And a lot of neuropathy is very vague, it's not individualized. And so to be able to sort of take our Eastern approach and then find that same type of individuality and specificity from a Western perspective and really start to pattern identify this from a Western category, this only helps us get very specific, because otherwise people sort of get thrown in categories of your carpal tunnel, your piriformis syndrome, your this, your sciatica, and not really understanding what that truly means. Are those things common? Sure, but they're not quite as common as we think from a specificity perspective. Peripheral nerves have multiple entrapment sites, and there are tried and true ways to really sort of figure out exactly where those things are and be specific about it. Then we can apply all of our Eastern techniques on top of that with specificity applied to the Western approach and have instant success with these cases.
That sounds amazing. And what is a clinical application of your class?
We're going to really fortify a great neurological exam, a great understanding of the anatomy of the central nervous system, the peripheral nervous system, and why certain things present symptomatically, so that we can understand what to hone in on and we can understand what to leave. I think when you're treating, it's as important to know what something is not as it is what something is. And our scope of practice varies from state to state. It's not something that, not for all practitioners, we don't have the ability to order an image. The downside of imaging is that they often pick up incidental finds that really attract a person to want to treat that, when that may not be what's causing their symptoms. I find that a non-image, good quality physical exam, neurological exam, is going to be more specific, and it's going to tailor to their symptoms a little bit more, because most of that involves provoking and alleviating their symptoms just anatomically. So if you can recreate something in your office and you really understand what you're doing, you know exactly where it is. An image would confirm this. And then it would probably show you some extra stuff and tell you, no, you don't need to put that in front of a surgeon right now. No, you can leave that alone. And so again, it's really about the clinical application of how do you build confidence as a practitioner to know what something is and what something is not, and not rely so much on confirmation bias or these are things that are popular, or, a lot of times our patients come in and they say, I have this, I have that. And then I'll do an assessment and I'll find out, absolutely, you don't have that. I see why somebody maybe would have told you that, but let's call it this. And this is a little bit more specific. Let's treat this, because, usually people have come to us after they've been treated and, maybe with mixed results. Maybe they've already plateaued. Maybe they've had some limitations. So where can we fill those gaps? Because we're the pattern people. So we can embrace the patterns from all different approaches and paradigms.
Wow, that makes a lot of sense. And what are the benefits of taking your class?
The benefits would definitely be, like I said, specificity in treatments. It builds a vernacular that interprofessionally is extremely important. The neurological exam is something that I do not see people doing anymore. It's not, and I mean, these are, practitioners that absolutely should be doing them. I also have heard people say things like, yeah, I run those exams, but I never find anything on them. And that is also not the case. If you know what to look for, you'll find something, if it pertains to the client, obviously. So it helps us build a vernacular that we can take and build relationships with other practitioners so that we can, really sort of be inclusive and included, and not just out there on the periphery in terms of like, oh, well, why don't you go try this because nothing else seems to work. No, interject yourself into this clinical team and say, these are the findings that I have on this patient, confirm it with an image, and then help all of those practitioners that you are working with as part of a healthcare team really, really get this job done for your patient. It's efficient, it's good communication skills, it's accurate.
Amazing. So the benefits are not only in your clinical practice, but also in your professional relationships with,
Absolutely.
Right. Awesome. And can you share with us your professional history?
Sure. I am a licensed acupuncturist, board certified herbalist. I'm also an anatomist. So I am the course coordinator at Seton Hall University's Interprofessional Health Sciences and School of Health and Medicine. I teach growth dissection and lead all of my med students, PAs, PTs, athletic trainers through their first cadaveric experience. So lots of dissection. I'm also the co-founder and one of the instructors for the Immaculate Dissection professional continuing education seminar series. I own a clinic here in the city and teach for a couple of different institutions.
Wonderful. And what city, where are you located?
I'm in New York City. New
York. Very cool. What would you say is the success rate of using your technique in the clinic?
This is a question that I'm actually really glad that you asked, because the anatomy doesn't lie. It just is. We can't make up anatomy. It is. It's right there in front of you. And so if you're able to manipulate the person's anatomy so that you can have it confirm, it will absolutely confirm everything that's on an image. You can have a very, very, very high suspicion, I would say 90 to 100% of exactly what's going on, and then have that confirmed with an image. This is what I've seen within my practice as well. The few things that you may or may not be able to see is, is this space occupying lesion a synovial cyst, or is it actually, a discogenic piece or something? Like some of those things you really sort of need an image to confirm. But as far as which spinal level are we working with, which peripheral nerve are we working with, these things are a very, very, very high success rate. Like I said, 90 to 100%.
Amazing. And can you describe a case where you had the best success using the knowledge that you'll be sharing during your class?
Yes, I have had multiple cases of patients who come in with either self-diagnosed or confirmed by another provider that they have carpal tunnel, and even had carpal tunnel releases, still have the carpal tunnel. And it's because the problem didn't exist in the carpal tunnel. The problem exists a little bit higher up. The problem exists either here or here or here. And same thing with piriformis syndrome. I have lots of patients that will come in with a diagnosis of piriformis syndrome. I'm thinking of one guy in particular, piriformis, this has been told all over the place, even though it was specifically said on his image that his piriformis was fine. When I put him through a piriformis test, it did not provoke his symptoms, which means that he did not have piriformis syndrome. The problem was actually a little bit closer down to the back of his knee, which an exam, a good quality exam, will absolutely show you. It will absolutely recreate the symptoms and dictate your treatment principle. These are very, very, very common things that I see on a weekly, if not daily basis when I'm in my office. And it really sort of makes you be super on point with regards to your physical exam. And as acupuncturists, we understand that our treatment principle is derived from our diagnostic. And if our diagnosis is off in either Eastern or Western medicine, you can't derive an accurate treatment principle from it. So this is really sort of using all of the theory behind Chinese medicine and apply it to a slightly more orthopedic perspective, but still staying tried and true to our roots.
Wonderful. Well, thank you, Dr. Folkmer, for sharing your time and knowledge with us today. As a reminder for everyone, Dr. Anna Folkmer will be teaching on Saturday, August 26th, all day, starting at 9 a.m. with part 1 and continues after lunch with part 2. This class is being offered both virtually and live in Fort Lauderdale Beach, Florida, and it falls under the CU category of biomedicine for a total of 6 CU credits. Thank you again for joining us and doing this interview with us. It has been amazing to chat with you, and we will see you at conference.
Okay, thank you.